employed, I think you call it USSD technology or mobile-based technology. So something that is, less sophisticated compared to a smartphone. And these community health volunteers now are helping us in our home-based care program. Using that application, they're able to work as monitors and evaluators of our home-based care program. Again, a good contribution from ICT. And moving forward, even as we move on to the UHC agenda and ensure that we meet the President's objective in terms of ensuring that every Kenyan has financial protection, ICT will play a key role, ensuring that each and every one of you is enrolled in NHIF, ensuring that each and every one of you is able to access the healthcare services that they need, that we're able to identify you, that we're able to reduce fraud, we're able to be more accountable, all through ICT. Now to the numbers. Today, we had 3,918 samples that were tested. 178 people tested positive for coronavirus. This brings to total our country caseload to 5,384 so far. And cumulatively, we have tested 314,000. All the positive cases, except 3, are foreigners. We have 123 males and 55 females. And our youngest today is a 1-year-old infant, and the oldest is 76. Nairobi is leading today with 100 cases, followed by Kajiado with 21. We have Migori having 17, Kiambu 16, Busia 8, Mombasa 7, Machakos 4, Nakuru 2, Uasin Gishu, Kericho, and Taita Taveta each have 1 case. It's important to note and to appreciate that today we've discharged 34 patients. This brings the total number of recoveries to 1,857. We have also lost 2 patients today, sadly, and therefore our tally in terms of fatalities comes to 132. And our heartfelt condolences are extended to families and friends who've lost loved ones. Today, we will not be able to go through the disaggregation, but we have that data provided for you. As promised also, we've been able to provide for you a table that looks at the different positivity rates per county in terms of the samples that we've collected. And as I conclude, I'd like to express my sincere gratitude to all members who are present here today, taking recognition of all the healthcare workers who are here today. Let me assure you really, from the beginning of the coronavirus response, all these faces that you see here were not sleeping. Perhaps they might be the first customers of this call center today. I'm sure they could share lots and lots of stories with you in terms of the hardships faced and the mental health issues that come with dealing with such a pandemic. However, we are stronger today, again, through that collaboration. We've been able to set this up. And remember, we also have a similar service that is available for you Kenyans, 719, again, a call center that is in this same complex. Utilize this facility. Mental health is not an issue to be ashamed of. We all are able to, be afflicted from this or have suffered at one point or another in our lives. And so let's come together, assist each other, and try and, move the country forward. I do want to continue to urge you again and to remind you to continue adhering to the containment measures. Let us wash our hands. Let us physically distance. Let us mask. Thank you. Questions?
Thank you very much, Waziri. Maybe time to ask questions now?
Yes, we can have questions.
Please, you can use this one here, so that we can hear you. Please come closer here.
My name is Purity Muse from KBC. I have 2 concerns. One is on the capacity of 100 days now. The tests that we are conducting still varying samples, 2,000, 6,000. So have you been able to establish how we can get a constant figure so that we may know whether the rate of infection is going high or low? And number 2, how many health workers have tested positive so far? And the ones that you had reported, do we have recoveries or even fatalities from that number?
Any other?
My name is Bernard Gitau from People Daily newspaper. My question goes to CS Musheru. We have had some claims that those countries that have taken and embraced 5G, they have the high cases of COVID. And in the country, we have those masks. And some are calling for them to be removed. And I don't know, that's a claim that is all over. What is your opinion on that? And my last question goes to the CES. It goes to deal with poor sanitation. As we have the COVID in this country for the last over 100 days, we have seen the improvement in terms of hand washing and improved sanitation. In terms of the disease burden trend, have you seen the reduction? And if you have seen, at what rate? And we have seen the country have been losing a lot of money because of poor sanitation related diseases. At this moment, in the last 3 months, how much have we saved as a ministry in terms of the reduction, if there is any, on those diseases? Thank you.
My name is Mwangi Maina from TV47. I have 2 questions to CS Dr. Masi Mwangangi. First, previously you were saying you were giving us figures, a breakdown from Nairobi, especially in areas in Kawangware, Kibra, and Mathare. What happened? Those areas have ceased to become hotspots. Then question 2, do we still have Kenyans or people who are in quarantine facilities, and what is the condition of the quarantine facilities? We have complaints from Thika Level 5 hospital that the situation in that place is deplorable. Thank you.
Thank you.
Hi, my name is Graham Kajula from The Standard. My question is about the Jitenge app that you had proposed earlier. What happened to it? Why is it not being used in the home-based care guidelines? And I would like an update on the 719 uptake of the emergency calls.
Great. Thank you. Let me start with Graham's question. So 719, call center is actually here, and it continues to thrive. As mentioned, we do have 16 medical officers who are there. Again, a partnership with Safaricom, Ministry of ICT, Ministry of Health, and different partners, including KMA, who was involved in the training of these medical officers. The hotline continues to function. However, we've noticed that there's a declining trend in terms of the calls that Kenyans are making. And so we continue to appeal to Kenyans to make use of this line. The workers are there, they're ready for you, they're waiting, they're well trained, they have the material, the knowledge that they need in terms of relaying the correct information to you. So 719 continues on and it is active. Regarding the Jitenge app, along with many other numerous apps, I'm happy that today we are here with Waziri Msheru, just because he put together a team that was looking at innovative use of ICT when it comes to COVID-19. And so I'm sure he'll help me here in providing an update as to where that team is, because this team is going to look at all these applications, ensure that the applications meet the various protocols, that the applications are able to adhere to the various laws that exist when it comes to data protection and privacy. And so I think he'll provide a better update as to how that would be looking like, but it's an application that we really see will be useful when it comes to home-based care and moving forward. In terms of a question, I think, from Purity, thank you, Purity. You've raised concern over varying samples, and you've requested that we have constant samples in a day. Perhaps what I can say is that part of how we collect our samples really is dictated by the system we've set up in place in terms of the rapid response. So usually how this works is that the team sitting at the AOC is able to receive alerts from across the country. And remember, in the beginning, starting with 2 labs, we were able to move to 27 right now. So we have these alerts coming in, and this team is then therefore able to redirect that call to the necessary county. So for example, they get a call and it's coming in from Turkana. They're then able to transfer that alert to Turkana County. Turkana County is able to mobilize its county response team, and using the nearest lab to that county, they're able to collect a sample. Now, when it comes to processing of this sample, the machines that we have, and I'm happy today that I have Dr. Kamuru here, he also runs one of the COVID-19 laboratories. He will share with you and explain to you that for you to be able to do a run in one machine, you have to have collected 94 samples. And so the idea is that you've gotten the different calls from the different counties, so you collect your samples and you make sure you have a batch of 94. Then you run the test. And so because of that intricacy when it comes to processing and running tests for PCRs, the numbers can never be a constant 3,000 every day. There will be variations depending on the alerts that are coming in. And remember also, we are testing people who may be in quarantine, people who may be discharged from home quarantine. There are many, many processing and testing sort of centers that are there. So to get a constant number is difficult. But then I think also what you're calling for perhaps is increasing in terms of capacity for our testing. And I'm glad to note that the ministry has improved its capacities and continues to improve its capacities. And so in the coming days, you'll see more numbers of testing. We have kits that are coming in, some that we expect to be here. And so these numbers will continue to increase and our testing capacity will improve. Concerning the issue of sanitation, again, time and time again, we've emphasized hand washing is the trick when it comes to coronavirus, and perhaps even the trick when it comes to many other ailments that deal with water and sanitation. What we've seen is that there's been a mixed picture. We've had some reduction in some areas. We've had fewer reported cases of diarrheas and choleras, and we've had, in other instances, a plateauing of the cases. What we are doing internally as a Ministry of Health is to be able to sit and look at our data holistically and perhaps look at our data beyond this time of COVID to be able to really come with a true picture of whether there's been a true reduction or a true increase when it comes to these diseases. And again, in terms of costs, it's important to note, putting a patient through treatment, say a patient who has most of the time a waterborne disease, would require admission, would require IV fluids. There's a lot of care that goes into that. So once we do our data, and our data tells us that we actually have less cases, then of course we expect to see reduced costs. Allow us to work on that and perhaps give you a quantitative figure in the future. Someone mentioned today that I said we won't share our disaggregation. What I mean is that today, because we are here and it's a very cold day, the sun is really, at the lowest tone, we will not go into disaggregation of the whole country in terms of the sub-counties and the wards that we have, but we have that information for you. Kawangware remains a spot. We have those figures. The different little areas that we've been highlighting, Westlands remains a spot. We are seeing Kilimani, that remains a spot in Nairobi, and the same of different other areas in Mombasa County and the other counties. Busia, there's a spot there again, especially at the entry for the truck drivers. So this data is available. We are not saying, and I don't think we've been able to declare that any area that was once a hotspot is no longer a hotspot. In fact, yesterday we were able to articulate that Mombasa now has the highest attack rate. It means if you're in Mombasa, you're most at risk. It means when you're in Nairobi and you're in Westlands, Kilimani, Kawangware, then you're most at risk. And so we'll continue aggregating this data, and it's available for you for the whole country, for all the afflicted 40 counties. I think at this point, I'd like to invite CS Musheru to answer a few more questions, and then Dr. Kamuri will be able to explain further when it comes to the testing for COVID.
Thank you very much. I think CAS, we should appoint you our ambassador for ICT in the way you have spoken. So thank you very much for the kind words, and really an indication of the partnership that we've held with the Ministry of Health and will continue to. EMR is the electronic medical record, which every citizen will actually have alongside the Huduma number, as that is provided. And that means wherever you go in the country, you will have your medical record following you to make it easier to ensure you get the right treatment wherever you are. You know, when things happen and you don't understand what the issues are, you always look for different reasons. And this idea that 5G is what is causing COVID in Kenya or in the world, I think there is a problem. Because in Kenya, we do not have 5G. We have not installed any 5G base stations, and I've seen we have over 5,000 cases of COVID. So it's not clear where then those would have been. But I would say right now, from a technology point of view, the technology that is used for whether it is 3G, 2G, or 5G, the spectrum that is used already exists. It's just how it is used. And so far, there has been no studies that have shown that there is any problem with the 5G that we have seen, and the Communications Authority already gave a very clear response to that. So we will continue to observe and monitor, but at this stage, our networks are safe. Our networks are working well, and this is what we are using for all our communication. And so I continue to encourage Kenyans to feel free to continue to use services. As regards the different applications and innovations that the country has been presenting, We've had multiple groups of people receiving the different entries for innovations and the different applications. Let me start with Konza, who had a hackathon or a challenge that they put forward to Kenyans on how to fight this pandemic. And they received over 300 applications, after which they shortlisted to 48. They shortlisted and then gave them another challenge. And now they have about 15 that they have selected that have won. And those are being now coached on how to go to market. They are receiving support from funding to advisory services, and that is ongoing. The COVID-19 Advisory Committee that I established, that is chaired by the Communications Authority, has also been receiving to date over 400 different innovations. They've shortlisted about 100. We will be having a meeting next week to see how to advance those that have come forward. We are seeing some great innovations from Kenyans, and I think many of these innovations are not just for the COVID time. We will use them even beyond. What's important is that we are making sure first you patent and you protect your idea. We don't want to receive ideas and then later people are saying we have stolen the ideas. No, we want to protect people's innovations and ideas and ensure that those ideas, once they go and monetize, they will create jobs for this country and we will see a flourishing industry. The Silicon Savannah, as we call it, is our Silicon Valley, and we expect to see a lot of these innovations growing. So we are working on that, and I hope you will continue to give us your entries. Asanteni sana.
CS saying it's very cold here. Literally, it's very hot. We are all burning. Two things. One, the Corona has no respect of persona, so it's not unusual that we have also health workers admitted. At the moment, I have 5 staffs admitted, but these are not for Kenyatta National Hospital. The daycare center serves for all health workers in Nairobi metropolis, so they are admitted there. 2, will not give you facts about whether the disease burden has come down. I'll throw the question back to you. When is the last time you had somebody has a diarrhea? When is the last time you had somebody next to you coughing or having cold sores? That can tell you the numbers have come down. For obvious reason, change of habits, change of greetings, change of distancing and such things. And even sometimes our eating habits have changed now that most of us have to eat from where we cook because of obvious reason. So the disease burden has actually improved. We have registered very few, even pneumonias in children have actually come down. Diarrheal diseases have actually come down. We are actually excited. We are hoping even after Corona is gone, we would wish all Kenyans would continue having the same change of social behaviors. Why the parameters of lab would differ on different days, it has several aspects. One, from the source, who are we testing, where are we testing, and who is testing. It depends on the number of the samples that we have received and the logistics of receiving. And that's why you'll notice, even on weekends, Monday, Tuesday, the numbers will change depending on the samples that are drawn. The other thing that we are doing, even from now onward, even another 2 weeks, we'll even have, the capacity has increased because the ministry has continued investing on testing equipment. Like now we have just received another testing machine in Kenyatta. Thank you to the ministry. So we will actually even double that capacity of testing, and we'll also increase the turnaround time. So we will not be giving you data for 2 days. We'll be giving you data for hours. But you must know that the testing of COVID is not as easy as it looks. It is something that takes several hours depending on the machine you are taking. However, it's good to tell Kenyans those figures you are getting, they are factual. There are many people who are saying people are cooking datas. You only cook something you will eat. This is not data. So the figures that you are getting are figures that are real time. They are getting from, and in fact, we relay those results directly to the center as we pick the results from the machines. Thank you very much.
Thank you so much. Thank you.
Hello? Okay. We would like to call this meeting to a close, but once again, we would like to thank Honorable Musheru, Dr. Mercy Mwangangi, chief guests, esteemed guests, and the media for gracing this occasion and showing true support to our front line. So, asanteni.
Thank you.
Njũng'wa ya mũtheki.